Hi, my name is LaJoy Johnson-Law. I'm a Ward 8 resident, and I've been a healthcare patient at Community of Hope for the last 4 years. So when COVID first hit, my daughter was really, really sick. Like, this was like a week before the mayor shut everything down. And I actually thought she had COVID. She was so sick, so I took her to the doctor, and they were like, no, this is just one of her normal spells. She is an ex-preemie baby. So my daughter was born at 23 weeks. So she was born at 1 pound and 6 ounces, so teeny tiny. And she is diagnosed with chronic lung disease. She's diagnosed with epilepsy. She has a laryngeal cleft, and she also has some special education needs at school. So I have a child, with multiple disabilities going on. She's 9 years old now. And so when COVID first hit, I was just, I was like, oh my gosh, like I would feel devastated if I literally gave this child COVID. Mm-hmm. And so when they were first starting to talk about the vaccines, I had one eyebrow raised. I was like, no. I was like, just the history and the unfortunate history of, the country and African Americans and medical treatment and vaccines. I was just a little like leery. I'm like, I don't know. And then I was on social media and that made it worse. And I was like, okay, like I need to take a cue because I'm a PhD student and we're always talking about peer-reviewed sources. So I put down social media. I actually had to put down the news. And what I did was I started to do some research into mRNA. I started to do some research within the COVID vaccine, just different like mRNA and different vaccine technology. And I went back, I tried to do recent research. So I went back like 5 years. So I went back to like 2015. And and these are like scientific journals. These are, different studies that have been done already and showing the promise of mRNA technology and just how it can work, with different vaccines. And so I just, and just leading up to COVID. And so I just started like reading, right? And just looking at, okay, what's really happening? And then I started doing some more reading, like through the CDC and other websites to show we're in a public health emergency. So a lot of that bureaucracy that happens is actually gone because the people are suffering, people are dying, the economy is suffering. This is this ain't a United States thing. This is a global thing. This is a global pandemic. And, we need to figure out how to get this under control. And so I was just looking, into those different articles and realized this technology has actually been around for a little while, actually. Like I read an article back in 2016 where they were just showing some real promise with, mRNA technology. And so I'm like, okay, you know what? I'm like, maybe I should really look at the vaccine and like really check it out. And so, concerns was, I'm really nervous for my daughter. If something happens to her, I would never forgive myself, like at all. I just would never forgive myself because I remember when my daughter, it's something called RSV that children usually get. And I remember her literally fighting for her life. I remember the doctors talking to me about how she's not going to make it and how I needed to start funeral planning for her. And so I know what it's like to plan a funeral for a child. I've never had to go through it, but I know what it's like to plan for it because that's what we started to do. Because she was so sick, we just didn't think she was going to make it. And the doctors were literally helping me funeral plan. And so I think about things like that. So when I think about COVID and it's like, I can't go through that experience again. And I can't risk myself getting this disease and then giving it to her. Like I'm a single mother. I'm a proud single mother, but I am her primary caregiver and I just wouldn't want something to happen to her. Being fully vaccinated, it has helped me with some of the worry, not all of the worry, but just some of the worry. And I think the biggest worry, protecting myself to protect my daughter. The biggest encouragement to the Ward 8 community is to really do your research. And if you don't know how to do that research, to reach out to organizations who are and have done the research, like I'm thinking about Community of Hope, I'm thinking about Martha's Table, reach out to your doctor, reach out to your healthcare provider, reach out to medical professionals, reach out to scientists, reach out to your elected officials. But to reach out to folks who have done the research or know where the research is and can tell you what's going on, or to do the own research yourself. You can use Google Scholar. I think is it Sage Publications? And you can just type in Google peer-reviewed scientific journals, peer-reviewed scientific articles, and type in COVID-19. You can do this research from your phone, from your computer. I'm not sure if the libraries are open just yet. I know there's a technology divide that's happening here in the ward, but I'm sure Community of Hope and other community-based organizations. I know Cora Masters Berry has been just trying to get the information out at the Southeast Learning Center, and just different folks that are just really trying to push out accurate information and for Ward 8 residents to make an informed decision. I'm not here to tell you what to do. I'm here to share information so that way you can make the decision for yourself. Because oftentimes Ward 8 is left out and we don't get the information, or we're last to get the information. We weren't last this time. Ward 8 was actually first because it was hit the hardest by COVID. And for us to be hit so hard, we have to arm ourselves with accurate, factual, honest, and true information. So please go do that research and connect with your community-based organizations and connect with folks that have the research. If folks are just talking on social media just to be talking, that's not scientific information, that's an opinion. So I encourage you to look at the facts versus looking at social media's opinion.